after that presentation, what else can I give you? He said, it wasn't that a kind of a powerful presentation. So what's your reaction? Are you interested in becoming a forensic psychologist? You're not interested in forensic after all? You didn't mean that, did you?
I can't believe that that's your reaction. I'm surprised. I guess I didn't do my job well at trying to get you all
you
roped
did it.
in.
You did it well. You did it well.
I was gonna say I was interested in being a forensic psychologist, and the reasons why you brought up is the reason why I'm like thinking if I still want to be clinical, because I don't think I'll be able to disconnect myself from the patient.
Well, we're going to talk a little bit about that. But one thing became clear is that you just don't become a forensic psychologist. You get there from many different directions. And the direction that was presented today is the kind of is familiar to me and to many others, which is the following. And many of the things that she presented today, I was going to highlight it, but I'm not going to repeat it. I'm just going to focus on some other aspects of the presentation. The thing that came clear was this. She started as a clinical psychologist. What does it mean? That she started to know about what psychology is all about, to understand psychology as a science and as a discipline, to get to that point first. Because in the final analysis, you cannot be a forensic psychologist, an effective without knowing your discipline. And knowing your disciplines requires for us to be very knowledgeable about not only how we understand psychological disorders, and we do that, the research behind that, the foundation behind that, but also how to evaluate that in a way that provide us with what we consider a psychological truth. Another thing that came across in her presentation that I like to emphasize is that part of that search for the truth requires for us to look for multiple sources. That it's not possible for you to just rely on one single source and make a determination about that which you've been asked to make a determination on. And the extent to which that is possible, then you become the scientist. You become the searcher to trying to get to the core issue that you've been asked to evaluate as a forensic psychologist. And one of those greatest challenge for all of us is those instruments that we use, are these instruments evaluated and valid? Are they reliable instruments for the forensic question that we're trying to address? And that is one of the challenges. Can you make a determination that even though after clinically it makes a lot of sense, but are these instruments or sufficiently valid for the forensic sample that you're trying to evaluate, the prison, for instance, the hospital setting? Are they being valid and reliable for that population? So here comes the scientist in you in trying to make sure that at the end of the day, whatever you decide to do, that you're trying to answer that question with, yes, the instrument that I'm selecting today have been validated with a sample similar to the one that I'm using for the evaluation. If it's not the case, then we have to explain why not. And in that context, here comes the scientific aspects of what we do, is that we use the science as we know it in terms of generalized to other populations based upon what we know with regard to research findings. So let me tell you how I got here. She told you how she got there from a clinical psychology perspective, and I did start as a clinical psychologist, and I am a clinical psychologist. I didn't stop being a clinical psychologist. But I also consider myself a psychologist first. That psychologists that tend to do clinical work, but that's not the only thing I do. I also do research. I do psycholinguistic research. I've done a lot of psycholinguistic research and written about it, having to do with how can we appreciate the relationship between language and cognition, and how can you evaluate that? Why does it become important? Well, the patient population now that we are trying to evaluate, where do they come from? What effect do we have in terms of the cognition? What effect does it have with regard to the evaluation of intelligence? And the more we know about that, the more become important in terms of answering the forensic questions as well. So I've been, in fact, one of the first involvement in forensic was in one related to a capital case in New Jersey. A case of someone that has been already found guilty with a capital offense, and the question is whether he was going to receive what. And so I was asked to evaluate what transpired in terms of the evaluation of the two professionals that were involved in evaluating the individual prior to the judgment of the sentencing. And so, but the person was actually Spanish speaking. An evaluation was done in English, and it was used in a translator, and it was used an instrument that had not been used for this population. So when I look at the case, it was clear that we have tremendous holes. Not that the crime was not committed, but the fact that this person, this individual, this evaluation, was that a fair evaluation? That was the question. And that's all I answered. I didn't say whether he was guilty or not. It's the evaluation, and that's all. And one of the things that happened here is the fact that we become clear as we get involved in these cases that we're not really prepared to deal with a forensic question unless we are trained. So then I got involved in other ways with the forensic setting. It was a bunch of lawyers had a number of cases with lead intoxication. The question was, what effect does it have in the cognitive development, linguistic development of these individuals? Now, that's a question that can be answered in many different ways. But this was a forensic question. And here I am trying to answer the question clinically, from the clinical psychology perspective. It's a problem, and it was a problem. And I became more and more aware of the importance of you're not doing any service to those that you're providing services if you're not well prepared in the setting that you are practicing. And that's a dangerous territory to get into. And the more we know, the more it's important for us to become much more aware of what it means to be a forensic psychologist. Now, I asked you the question, how do you feel about such I was excited about hearing all the components of what she was referring to. It's a tremendous challenge. The difference is that when you have someone who has this level of expertise, is that it's more likely that the patient, or I just used the wrong word, they are not patients, they're not your patients, but this is the clinical piece. They are your client, they are the defendant, but they're not your patient. And so, but it's more likely that the person that you're evaluating is going to be receiving the treatment or the evaluation in the way that is more humane there is no reason why you cannot be humane and also be an effective forensic psychologist. Let me, and again, there are many ways in which forensic you can become involved in forensic. I just gave you an example related to you can be called in to just evaluate what has been done by others. You can come to do the evaluation yourself. If you are a treating person, of course you shouldn't be the one evaluating. And it was mentioned here as an important distinction to be made, and I like to emphasize it here again. And the reason why I'm saying that is because that was one of the challenge that some lawyers may just ask you to do both, and they said, "But doctor, why don't you just evaluate the person and then you can treat the patient? So you already evaluated the patient, so treated the patient." And that's a mistake. I have heard it over and over and over again. And what happens in that situation is that it's a conflict of interest. It becomes a conflict of interest that can be totally detrimental for the client that you're trying to represent. Now, it is possible, however, that as a therapist, you can be called to testify, but you're not testifying as an expert witness. So that even if you're not interested in become a forensic psychologist, that doesn't mean that you can avoid being called to testify by the very nature of the fact that you're dealing with a condition and a human interaction where the legality of things can be come into play. And so that's how many of us ended up in the place where we are today, in which now we've become a lot more versed in the forensic arena. And one of the things we're doing in the division of forensic is to provide opportunity for training more and more. And this is what I'm going to spend a little more time here talking about it. And before I forget, I brought in some application for as a NYSPA membership. And so you're interested in becoming a NYSPA member.
It's around one now, and then we could fill them out.
As a NYSPA member, and as a student, the information is there, and you can provide the information back to me or send it directly to the office. So, just to highlight the three roles that the psychologist could have, which we have given you example today. One is you can be a consultant, and that's all you are. And you can be a consultant for a specific question at hand. The question at hand at the point is the evaluation, the capital, in the capital case, was the evaluation fair and adequate for the patient, with regard to this client. You can be called as a treatment provider to talk about the treatment. And again, that's another kind of worm. And I remember one of the things that I have done is that I was the director of the Center for Psychological Service and Clinical Studies at St. John's University before I became the director of the postdoctoral in forensic psychology. And one of the things we did is to our students, said, we're going to protect you, but this is a training site, not a forensic site. And what we're going to do is we're going to protect you from having to go to court. So if we know ahead of time that some patients are going to come in with a forensic question, we are not going to accept those patients. But can you stop that? Not totally. So what happens is in cases like that we ended up as a administrator having to handle cases like that in trying to protect the having to go to court, and we ended up being successful about doing that. But as a treating person, you can be called to actually testify about what transpired with this case, with the cases. One of those cases for me was when I was at Kingsborough Psychiatric Center before coming to St. John's, and there was an interesting case. The case was the following. The person came for outpatient treatment, and he was assigned to me. He came in with his wife, very jealous, and at some point became very agitated, and so we went in the middle of evaluation to see what we can do about him and about the situation, but they disappeared. Patient disappeared. So what happened in between was the following. He was with his best friend, got very jealous, and found the friend in the home with his wife, speaking in a way that was suspicious to him. So he confronted the friend and proceeded to grab a knife and plunge it right on the chest. He said, I immediately realized what happened, took it out, called the police, and began to just cry and cry and cry. So now he ended up in jail. And he was out, knocking on my door, said, doctor, I need to see you. And so I said, well, what happened for 3 months? I haven't seen you. He said, oh, no, I have to see you. I have to see you. They need to know that I've been seeing you, right? I said, well, not for the last 3 months. I haven't seen you for a while. I said, no, please. And so at some point he said, well, why don't we come tomorrow? He came without an appointment, coming tomorrow, and we'll have an appointment at 9 o'clock in the morning. In the meantime, the lawyer called and said, doctor, we want you to testify that the patient is in treatment with you. I said, he hasn't been in treatment with me. He said, no, he has been in treatment with you. You have seen him, right? I said, well, yes, I evaluated him initially, but, well, we're gonna call for you to testify to the fact that he has been in treatment with you. He said, well, let me tell you this. I will come, and what I'm gonna say is the following. You tell me whether you like to hear this. And so he finally decided that was not in the best interest of this individual to call me in. But again, that was one situation in which if I had been forced to come to court, that would have been more just as a treatment provider, not as an examiner, not as a forensic psychologist. And so the last one, it was the one that was described here, which is as an examiner. And for that, there are certain characteristics that we look for. Again, I didn't want to include some of the things that has been already covered here, but there are certain characteristics in terms of the role of the psychologist. The question is, who is the client? In the case of the forensic, who is the client?
The court.
Is the court or is the attorney? The one who hired you. What's the approach? If you are a therapist, you tend to be sympathetic, aligned with the client, with the patient. As a forensic psychologist, you are to be detached and neutral. You're doing evaluation, you're not treating. What's the goal of the evaluation? In therapy, to improve adjustment of the examinee. In the forensic setting, is to assist in the decision making. Different goal. The focus of the evaluation, if you were in the therapeutic context, would be to deal with symptoms. In the case of the forensic one, is to deal with the psycho-legal issue, to address the psycho-legal issue. Response style tend to be, as I said, evaluative. You're not here to be engaging with the client or in a way that is that may create a sense that there is a treatment going on. Information sources, multiple in the case of the forensic. In the case of the clinical, for the most part, it is what you can gather from the examinee and what you can gather from the assessment data. Confidentiality, is there a confidentiality here? No. In the case of the forensic evaluation, there is no confidentiality, which is the one that you say to your patient when you say, everything they say will stay here. In the case of a clinical setting, unless there is a possibility of damaging yourself and others, or in case of child abuse, those are the conditions under that will be a breach of the confidentiality. In the case of the forensic, from the get-go, information has to be clear. Everything that you say here will be used for the preparation of the report that will be submitted to the court. What kind of privilege do we have with regard to the client, with regard to the forensic? Is basically as an attorney-client privilege. Everything related to that is confidential from that perspective. In the case of the therapeutic role, you don't anticipate much scrutiny about what you do. In the case of a forensic role, you expect a lot of scrutiny about what you do, and therefore, one has to be really prepared to support whatever we do. And the kind of things that we are doing right now with regard to prepare other those interested in forensic psychology is that we have developed a program, training program, that is based on the foundation of the discipline that is required for those who wanted to become specialized in forensic. It's required for those to have a good psychological foundation. And then on top of that, then we get into the specific about civil laws and what it requires for that, and criminal laws and things like that. I have brought a copy of what we offer in this kind of training, but it has a kind of a progressive one. The idea behind is to prepare those interested in becoming a diplomat in forensic psychology to actually be able to take on the examination for that purpose. And with that, I